So this is the group project for CSD 481. Our group name is TSH squared for Tori, Sarah, Haley, and Hannah. And we are doing our project on effortful swallowing. My name is Hannah, and I'm going to be the clinician today. And this is Sarah, and I'm just going to have her kind of explain what's going on.
So I had a stroke a year ago on the right side of my brain, and I had articulation errors, but I've been in speech for a year, and I just got released from articulation therapy. And as my articulation got better, my swallowing slowly started to get worse, and so I decided that I wanted to go to swallowing therapy. And so now I'm coming to Hannah for that.
Alrighty, well, I just have a quick question, real quick. Is your mouth more dry, or is it an excessive amount of saliva?
It's usually an excessive amount of saliva.
Okay. Well, let's work on some techniques for adult dysphagia. First, we're going to start with indirect techniques, meaning that we're not going to use food or liquid. So what I want you to do is you're going to do a dry swallow, and I want you to squeeze the muscles in your throat as hard as you can, and I'm just going to feel. Alrighty, this time I want you to try to imagine you're swallowing a really big vitamin, and like you're trying to push it down. Okay? If you are having a hard time doing that, you can tuck your chin in, if you wanted to do that, or you can also turn your head to the right side of your body, and that might help make it a little bit easier for that. Okay, so now I want us to work on some direct swallowing techniques, and this is going to be different from the last technique because we're going to be using water. So what I want you to do is take just a small sip of your water, and I'm just going to kind of fill your throat, and we're going to be listening for sounds of aspiration with that. Okay, so you did show signs of aspiration since you coughed. Okay, so there was some evidence that you were aspirating. So what I'm going to do is I'm going to give you a couple of techniques that you can do at home just for practice until we meet again. And then we can mark your progress as we go. So what I'm going to do is I'm going to give you this sticky note, and you can make visual notes to help you remember. And the technique I want you to do is going to be, you remember when we first started, you did the technique for dry swallowing? So what I want you to do is do that 5 to 10 times and do that 3 times a day. So I think that's going to be it for this therapy session, and I'll see you next week.